Hello, this video provides an overview of the use of family health histories in disease risk assessment. Healthcare providers have long recognized that risks for diseases cluster within families. In fact, this has been part of medical practice for centuries. Today, asking about the health of family members is a standard and required part of clinical practice. However, research suggests that processes for collecting family health histories are often incomplete and underused in risk assessment. So what is a family health history assessment? Ideally, it involves collecting information about 3 generations in the family. This information includes age, gender, relationships, any health problems or deaths, when they occurred, and racial and ethnic backgrounds. This information can then be turned into a pedigree, which is a visual representation of the family history. The more closely related individuals are, the more DNA and health-related risks they will share. For example, here, if the patient is marked in white, first-degree relatives in pink share 50% of their DNA, second-degree relatives, shown in blue, share 25% of their DNA, and third-degree relatives, in orange, share 12.5% of their DNA. So, how can this be applied to healthcare practice? Well, family health histories are useful because they capture a wide range of information. They can detect shared genetics, as mentioned previously. However, related individuals also often share environmental risks from where they live, as well as health behaviors. Family health history assessments can identify disease risks and suggest ways that patients can prevent diseases from occurring. Health histories can also help guide diagnoses and treatment approaches. Finally, because people often like talking about their families, this can be a way of connecting with patients. So what are some examples? A way that family health history assessment can be helpful is that pedigrees can assist clinicians in recognizing rare inherited genetic disorders. Each of these rare diseases might be unusual, but together across a population, they affect about 1 out of 17 people. For example, this pedigree could reveal to a clinician that a family is at risk for a neurodegenerative genetic disorder called Huntington's disease. Family health history assessments can also reveal risks for common diseases. For example, if you have one first-degree relative with cardiovascular disease, you have twice the risk for developing the condition yourself. If you have 2 first-degree relatives, that number increases to over 5 times the normal risk. The advantage to knowing about risk for common diseases is that many have known prevention measures that can be recommended to patients. So what would this look like for nurses? This would involve obtaining and recording a 3-generation family health history, which takes about 15 to 30 minutes the first time it is done. A pedigree can then be generated and disease risks assessed. Methods for doing this more rapidly with electronic medical records are being developed. Once risks are identified, a care plan can be put into place. Because health statuses change, it is also necessary to update the family health history during future visits. Thank you very much for listening to this discussion of family health history assessments. We would appreciate your perspective on the benefits and limitations of this strategy.